Hi guys, today we're going to work on placing a urinary catheter. A couple different ways you can place one. Today we're going to do an indwelling catheter. In the clinical setting, you will learn about straight catheters. Those are catheters that are not left in the bladder. We simply remove the urine and then take the cath back out again. Gabby is going to be demonstrating a indwelling catheter placement on a female patient today. Another term that you may hear used quite frequently is Foley. Foley is a brand of catheter, but they're interchangeable. So for lab, you may hear me say Foley or indwelling catheter. Foley is just a shortened version to make it a little bit easier. So the first thing that Gabby's going to do prior to entering the room is she's going to look up the orders in EHR. Today she's not going to physically do that, but we want you to be aware that those orders do need to be in place before you can place a Foley catheter. So she looked at the orders, and it does say to place an indwelling urinary catheter, so we're going to go forward with placing that. Upon entering the room, Gabby's washing her hands. And we want to be sure to go through our steps of identifying our client, checking that wristband to make sure that the name they're saying does match. We're asking, once again, that name and date of birth. We want to ask about allergies. Some of the Foleys come in latex, and if our client has a latex allergy, we want to be sure to have a Foley that is silicone-based. When placing a catheter, we also want to ensure that we're providing privacy for our patient. So we would close the curtain to do that. We're not doing that here today, so that we can videotape this for you. So we would close the curtain to provide for privacy and raise the bed up to a good working height. Remember, we're saving our backs here. All right, once the bed is at a good height, we're going to expose our patient. The first thing we want to be sure to do is some good peri-care. That's something that you would verbalize for competency purposes. You won't have to worry about competency until next semester. So once that peri-care has been completed, you're going to position the patient appropriately. So for a female, we're bringing the knees up and out.
I love the frog leg, guys.
Right, and we're exposing that vaginal area. Sometimes what helps is to have some clean gloves on. Once those are on, you can take a look to see where that urinary meatus is ahead of time. That way you have an idea of where you're actually going to place that catheter. Remember, everybody's anatomy is different. So one patient's meatus isn't going to be in the exact positioning as another patient's. All right, so once that's done, we're going to take off those gloves. Gabby will wash her hands, and she's going to set up her supplies. Now, for the purposes of setting up her supplies, Gabby has 2 tables available to her. Remember, we're looking at maintaining sterility. We're really in patient safety, and we're really focusing on those principles, not necessarily how you set up your Foley kit. So when Gabby opened that package, the whole kit comes out in one rectangular container. The paper that is in the package with it, that is just the label. That can be thrown away. Right, there's also a label itself for the Foley. So we'll set that aside for later. The kit comes in a wrapper, so the exterior portion is not sterile. However, the interior portion is. So it's just like setting up a sterile field. So Gabby's going to open that up. There's a little corner that's sticking out, right? And that's the part that you're going to pull on to start opening that kit. With this, you still have that 1-inch border.
To fight, guys.
They like to fight. So something just to mention, when you've touched the wrapper and it flops back into the kit, that's a contamination. All right, we're going to keep moving forward. We're going to say Gabby didn't contaminate, but just so you're aware that when that paper does flip forward, we like these mistakes to happen because we want you to see that that would be where a contamination can potentially happen. So Gabby's going to keep moving forward with this skill. So once her sterile field is open, she is going to take out her sterile gloves. So that top package, you can reach in and just grab those sterile gloves out without touching anything else. Notice that on her table, she does have an extra pair of sterile gloves that she brought with her. It's important to have some extra supplies just in case you contaminate the sterile gloves that were in the kit. At this point, she's going to don her sterile gloves. All right, now that her sterile gloves are donned, now just something to add, Gabby is a professional, so she knows how to don her sterile gloves and keep her sleeves out of the way. For your purposes, make sure that your sleeves are rolled up all the way. That will help to prevent any future contaminations. Gabby is sterile, so we're going to continue with the skill. So once the sterile gloves are done, there is a drape that is next on top of that kit. She's going to take that drape out. She can touch that anywhere because her gloves are sterile. And she's going to place that down on the bed without touching anything else. So that was an oops right there. We saw her contaminate that package.
So guys, learning point, that's why I bring an extra set of gloves with me. Because if I contaminate, I can take these off and I can now put on my new sterile gloves. Okay? So I'm going to do that.
And remember, whenever you're removing gloves, you have to wash your hands in between, even if you're putting a new pair of gloves back on. Now, as she's donning those gloves, just to show you, she put the packaging for the Foley kit on the end of the bed and opened it up nicely. This can serve as a trash can for any of the supplies that she needs to throw out while she's sterile. So that way she's not dropping her hand below her waist or turning her back to her field to throw things out. All right, so once she has those on, she has another drape. That's a fenestrated drape. So that's a drape that has an opening in the center. All right, so she's going to drape that over the patient. And that way only the working area is exposed. Once she's done that, inside the kit are some swab sticks. So they will be pre-treated with betadine.
And these ones are clear, guys, because they're simulated, so you won't actually see the betadine. Okay.
She's opening the packages up. This is preparing the supplies ahead of time. Also in your kit, aside from those packets of swab sticks, her kit actually has 2 packages. Most kits have only 1 package. She's opening the lubricant that comes with the kit. All right, so once that's done, she can separate the top portion of that container from the bottom. All right. So just to show you what this kit looks like, that bottom cardboard container contains the Foley bag and catheter itself. And that top section, once again, it's those swab sticks, the lubricant, and then you have a syringe that's pre-filled with either normal saline or sterile water. And that's what we use to inflate the balloon with once it's in the bladder. Right, so Gabby she could bring that top tray over to the sterile field that we have on our patient's bed. So that is sterile to sterile, so it's fine to move that kit over. All right, once she's moved everything, we have to determine a dirty versus a clean hand. So one hand is going to be used to spread the labia apart so that we can visualize the meatus. The other hand is going to remain sterile so that the catheter can be inserted.
Before I decide dirty versus clean hand, guys, I'm going to take both sterile hands and I'm going to put my catheter, the inserted part of the catheter, into the lube, okay, just so that it's ready to go when my patient is cleaned, okay? So I'm going to take my lube, and when you take the catheter out of the box, it's going to have this sheath on it. So take this off and kind of coil the catheter in your hand, and be sure that you don't just rip this off, because if you do, it's going to flop all over the place and you're going to break sterility, okay?
So once she has that catheter out, she's coiled it in her hand and she's sticking it right in the lubricant packet. Another way that you could do that is to squirt the lubricant out into this plastic tray that it came in and run the catheter through it. For lubricating purposes, it's ideal to have the entire length of the catheter lubricated, especially for a male patient. With a female patient, the catheter is not being inserted quite as far. A male has a much longer urethra. All right, so at this point, she has her catheter lubricated. Now she's going to designate her left hand, and that's her non-dominant hand, as her dirty hand, and she's going to spread the labia. All right, once the labia is spread, we can really visualize that urinary meatus. She's going to cleanse the area. So she's going to take out 1 swab stick, and the labia furthest away from her, she's going to go top to bottom 1 swipe. And that will be tossed. Then she'll take another swab stick, and the labia closest to her, top to bottom 1 swipe. And the last swab stick will be used for the center. And she'll go once again, top to bottom 1 swipe. And she's discarded all of those swab sticks. Now she'll take the catheter. You can bring the whole box over to the field. It is okay if it overlaps, as long as everything inside that box stays sterile. So once she's gotten to that point, she's going to take the catheter, work the packet off of the loop, and then she's going to insert the catheter into that meatus.
I'm going to ask my patient to bear down for me. And I'm going to wait until I see urine return. I'm obviously not going to see it on the mannequin, but when I do, I'm going to advance my catheter 2.5 to 5 centimeters more.
And she's going to hold that in place. Right, so on a person you'd see, like Gabby said, you'll see that flash of urine and then advance a little bit further. She's going to attach the syringe to the catheter port, to the balloon port. Now, Gabby's able to do this one-handed. However, for your practicing purposes, it would help to attach that ahead of time. And that way you can, you won't have to fumble with it too much. Gabby's used to placing Foley, so she's able to do this one-handed. Once that balloon port is attached, you're going to inject the saline, the entire 10 mLs, in. So she's going to inject the entire 10 milliliters to fill the balloon that's sitting inside of the bladder. Once that balloon's full, she can remove her hand and disconnect the syringe. Now, know that you have to hold the pressure on the plunger of that syringe while you're disconnecting. Otherwise, that syringe is going to fill back up and deflate the balloon. Once you have that syringe detached, you can tug a little bit, not hard, just a gentle pull back on the catheter just to make sure that you get a little bit of resistance so that you know that it's sitting in the bladder correctly and it's not going to come out. This procedure should not be painful for your patient. A little bit of discomfort, maybe a little bit of burning, but it should not be painful. Once she has that catheter, that tug, and she knows that it's in place, she's going to take the Foley bag out of the kit. And she's going to hang it on a non-movable part of the bed below the level of the bladder. All right. And then once that's hung, we would get our patient position so that the legs are down. Make sure that nothing is pulling on the Foley bag itself or the catheter itself, and we're going to attach it to the inner thigh. So for attachment, we typically would use something called a stat lock, or for lab purposes, we don't have a stat lock available to us at this moment. You could tape it to the bag, but you would use a drainage device, attachment device that's provided by your facility. All right, and at that point, to remove the fenestrated drape, we would just rip that. Clean up and discard your supplies. Thank you, Gabby, for that wonderful demonstration.
Thank you, Danielle.